everyone. I'm Bruce Carlton, Professor of Pediatrics and Director of the Pharmaceutical Outcomes Program at Children's Hospital in Vancouver. And in this segment, I'd like to implore PRETx users to do something that I think is definitely necessary in Canada and across North America. We treat children in emergency departments outside of pediatric hospitals, of course, and it seems to me from my experience that these hospitals really need better optimal management strategies for children, and they want them, they clearly want them, and what better place to come up with optimal use strategies than through PRETx and emergency physicians who specialize in pediatric care. So it seems to me that one thing that we as members of PRETx can do is to develop optimal use and optimal management strategies for children, evaluate those strategies to determine that patients actually have better outcomes, and disseminate those optimal strategies throughout large geographic areas like the province of British Columbia, which is 4 times the size of the state of Texas, so that all emergency rooms, regardless of whether they're pediatric teaching hospitals, can actually benefit from the expertise and the skill that exists within our pediatric teaching hospitals across Canada and North America. And one particular example I think about a lot is how do we instruct patients? What's the most effective way to get the message to families and patients that to prevent asthma exacerbations, they must develop preventative strategy management techniques before they land in the trouble that gets them to emergency programs. So what information can we provide to patients and families in the emergency department to prevent that next visit, which is unnecessary? And it's difficult. The emergency departments are not easy places to provide continuing care or preventative care or education. They're really meant to treat acute scenarios. But I believe that the pediatric emergency departments can come up with best practice strategies, evaluate their impacts, and then disseminate this to hospitals across the province that don't just focus on pediatrics, are more community oriented, and would tremendously benefit from that expertise.